After a meniscus surgery, it's absolutely critical to improve your quadriceps strength. So in this video, we're going to be covering some basic quadriceps strengthening exercises that you may be able to use early in your rehab and then progressing to higher level exercises. So that way you can see the spectrum of exercises that you can do. You want to make sure that you're following the guidelines of your doctor and physical therapist if you had a meniscus repair or a meniscectomy, because there may be weight-bearing precautions and you may want to initiate these exercises at a certain point in your rehab. But we're going to be covering some of the non-weight-bearing exercises first. These can be done earlier in your rehab and in your physical therapy. So this one here, you're going to see it's called the short arc quad. It's also known as supine knee extension. You can have a ball or something underneath the knee, and you're going to straighten the knee out and try to go through your full range of motion. Sometimes after a meniscus repair or surgery, those last few degrees of extension may be painful. So just stay within more of a comfortable range of motion when you're doing it. For example, just not going fully straight. And then as it gets more comfortable, then you can start to improve the extension. Some people have argued that you could sit up here with your trunk and maybe have some back support because the rectus femoris may be involved with the knee extension. And that's one of the quadriceps, but it also flexes the hip. And if there's weakness in the VMO or the vastus lateralis, some of the other quadricep muscles, then the rectus femoris may be substituting for that, and it may be hiding a weakness in your other quadriceps. So you can sit upright, and that may alter the length tension relationship of the rectus femoris, which may help you to isolate the quad. If you have difficulty recruiting your quadriceps in the early stages of rehab, the physical therapist may often use electrical stimulation to help improve the motor unit recruitment and get more contraction of the muscle. So we really want to make sure that the quadriceps are firing in those early stages of rehab. Another exercise that I'll commonly do with people pretty early on is going to be knee extension and sitting with a resistance band, or just going through active range of motion and sitting. This video shows the knee extension using a TheraBand or another type of resistance band with a chair, and then the band is tied around the ankle. And this is going to help to improve some of the quadricep strength and the range of motion of the knee. We really want to get that extension back. Now, these are the early stages of rehab. If you're already beyond this point, then you should be doing this exercise at the gym with resistance as well. You can see that I put 3 sets of 20 reps here. Could be done 3 times a week, maybe just 2 times a week. Really, the optimal amount of loading a muscle and for hypertrophy and strength training is about 2 times a week. You could do it 3 times a week, but you don't get too much greater benefit from that. But if you are having problems at a heavier load, and that weight increases some pain in the knee, it might leave it sore the next day, what you can do is you can do more repetition at a lighter weight. Just decrease the resistance that you're doing. Here I have 3 sets of 20 repetitions, and that way you're getting more frequent repetitions. So that's going to be 60 reps. And you could potentially do 5 sets of 20 reps as well, instead of doing 3 sets of 10. There was somebody in our meniscus care support group asked me this question the other day. They wanted to know different types of exercises that they can do, and they were primarily interested in squats and lunges. And I mentioned that, if you decide to go heavier with squats and lunges, you might be increasing the compressive forces on the knee, which could be okay, but depending on the extent of the meniscus tear, you may want to reduce that compressive load. So what you can do is you can still do squats and lunges, but just do them at a lighter weight and do them at a higher volume, and really focus on volume to drive blood flow to the knee and to help with the hypertrophy and strength of the knee. So sometimes you don't always need to increase the load. You could increase the demand and the metabolic stress on that muscle so you can get adaptation by going with higher reps and higher sets. So the next exercise that we're going to be covering here is going to be a wall squat, or doing like a wall sit. This is just a quarter sit. You could lean against the wall and just come down to about a 45-degree angle and hold for about 30 seconds. This is going to be an isometric contraction of your quadricep, and this is going to put a constant load on the quads so you can strengthen them, work on endurance, And I like this exercise because this teaches somebody how to evenly put weight on the left and right leg, and you can control the degrees of knee flexion. So early on with the meniscus tear, and especially with repairs, you might be limited with bending it to 90 degrees for a month. And you want to make sure that you're not going to go below that 90-degree point, because you can compress the meniscus and possibly ruin the repair. So this wall sit ends up being a good way to start loading the knee once you are clear for weight bearing. Moving on, we have a higher angle wall squat. You can go down a little bit lower. I believe this is going to go to about 90 degrees. So when you're clear to do that, this may be a good first step before doing a deeper squat. Before you're squatting down to 90, you might just want to learn how to control that joint position. And you can do this, and you can learn how to control that position in a controlled manner with the wall sits. Now it's time to move on to a full body weight squat. Initially, you could use some hand support like a TRX, or using parallel bars or the back of a chair, and you can take some of your body weight off of you. That might be the first way to start doing a squat. But then after that, you want to start squatting with your full body weight. I often have a chair or a bench by the butt, so the butt can touch it and then come back up. That will often promote the right type of squatting pattern. But the body weight squat is going to be an extremely functional movement. You're going to be doing sit to stands and standing up from different surfaces for the rest of your life. You need to stand up off of chairs, off of the toilet, off of the couch. These are things that you don't think about, but once you reach a certain age, you need to be able to stand up. Many of us too also sit for work a lot. So when you're sitting for a while and you first stand up, you want to be sure that you have the strength to do that. And oftentimes people will feel pain with that sit to stand because you're taking the knee from a position of being flexed and then you're straightening it out. So you want to make sure that you have the ability to stand up and do squats. And when you can tolerate about 3 sets of 20, eventually you can start to do heavier weight with that as well. The next exercise is going to be goblet squats with a kettlebell. Having a weight in front of you is going to put a little bit more demand on the quadriceps. So that way we're loading them a little bit more. When you're doing a body weight squat, you might be loading the hips a little bit more. But with the goblet squat, with the weight in front of you, you're going to be working on glutes and the quadriceps. So this is a good exercise for learning how to progress weight. And this might be a little easier than doing a full barbell squat at the gym. Then you could also try reverse lunges. The reverse lunge is a good way to start doing lunges. If you have any pain with it, you can do a partial lunge where you're holding onto a chair or parallel bars and just going through half of the range of motion. But I like the reverse lunge because you're stepping backwards, which is taking a little bit more pressure off the anterior knee. If you look at this video, you'll see that the knee is going right to the toe. And if you're starting to do lunges, then you want to usually keep that knee behind the toe so you can get used to that range of motion. If you have the knee going over your toe, then there's going to be a little bit more pressure on the patella. And it's really common to have patellofemoral pain after surgery and after meniscus repairs. So if you're having a little bit of anterior knee pain and you want to make sure you're not irritating that patellofemoral joint, then make sure that the knee is going kind of right to the toe. Now, as you get more comfortable with it, you can start to let that knee travel past the toe, because you're going to also have the knee go past the toe frequently with your daily activities, and especially if you're playing sports. So if you're going to be returning to sport or you want a higher level of function, you want the knee to go over your toe. You want to learn how to use your quadriceps properly and control that descent. You want eccentric quadricep control with your knee going over your toe, and there's different exercises to work on that. So I am definitely a proponent of doing knees over toes so you can strengthen the quadriceps. It just needs to be initiated at the right time so you don't irritate the joint, especially coming off of surgery. Now, the next exercise are going to be jump lunges. These are going to be for later stages of rehab once you are cleared by your doctor to do plyometrics. Plyometrics are rapid, quick movements. You're going to need these for playing sports and for sprinting and for running. And so this is a good way to learn how to initiate rapid, quick contractions of your quadricep. And the jump lunges are a great way to do that. You don't have to go down super low at first because the knee could get irritated, but this is something that you want incorporated into your program in the later stages of rehab. Now, you have to consider what your goals are. If you are trying to get back to sport, it would be a good idea to learn how to control this movement because you're inevitably going to be doing it while playing sports. But if you're not really trying to get back into something too strenuous, then I would be really conservative with the plyometrics because of the high load that is on the knee. You don't want to compress that joint. Remember, the meniscus is a pad between the tibia and the femur. And if you have the meniscus removed with a meniscectomy, or if you have it repaired, then the structural integrity of that tissue, of that cartilage, has been impaired. And you don't want to irritate that and cause inflammation to the knee joint and cause arthritis. And if you get arthritis, then that leads to a negative cycle because then it becomes difficult to improve your quadriceps strength because often you'll develop what's called arthrogenic inhibition, that is having pain in the joint, which causes an inhibitory effect on the muscle. So basically, you don't contract the quadricep as well because you don't want to get pain. And when you do a forceful quadricep contraction, that does increase pressure into the patellofemoral joint especially, but also the knee joint a little bit, the tibiofemoral joint, and it may not feel good. So if you're dealing with some inflammation, then you can, for short-term use, you can use NSAIDs. I'm a big fan of using curcumin extract because there's really good research for it for inflammation. So if you want to help control and promote a healthy inflammation response, head over to activeatoms.com. If you need more help and support with meniscus tears, then join our free Facebook support group for meniscus tears. I'll put links in the description below. But let me know how your knee rehab is going. If you have any specific questions about meniscus tears or other surgeries or knee pain or other issues, let me know. I'm a physical therapist. I've worked with over 9,000 people in the clinic, and I want to help you live a better life so you have better mobility and longevity. I'll see you soon.